Does the software alter the scan data after scanning in alignment? I have received several scan cases where the adjacent teeth are misaligned around the scan body.
This is the second question. A dental technician asked a question about the scan data he received from a medical doctor. He is curious as to whether it's normal for the scan data to look like this because it doesn't seem to match up with the adjacent teeth. So he wants to know if the software alters scans after scanning and alignment. He pointed out that the data alignment is not really precise as it is not 100% central. So today, we want to talk about the accurate scan protocol for scan bodies. At first, I misunderstood his question and thought the main issue was that the scan body alignment was not central. However, the issue he raised was actually about the scan data of the adjacent teeth not being retained, unlike when receiving data from other intraoral scanners. If we look closely at the scan data, there was not a sufficient amount of data for the scan body. This may be because not enough area was covered while scanning the scan body. Therefore, it appears that adjacent teeth and scan body scan data have some gaps and were not matching precisely. This of course leads to the scan body position to not being accurately aligned. When scanning the scan body using a magic scanner, we can choose to perform the full scan with the scan body or to scan separately the base and the scan body. When scanning the scan body separately, the positional relationship with adjacent teeth needs to be recorded, so covering sufficient area is important. Another user speculated that perhaps an incorrect protocol was being used during the scanning process and suggests that following the right workflow would correct this problem. The medical support team explained in detail that this is a characteristic of their scan software. We can just do a full scan with the scan body at a base scan stage and skip the scan body scan. In doing so, the separation phenomenon would not occur. Today, we revisit the scanning sequence and provide tips when scanning a scan body. Although this may seem basic, as many of you are already familiar with how this is done, we hope that this will help users new to Medit better understand the workflow. Let's watch the solution video together.
Since the interface of each scanner manufacturer's software varies, it is essential to have a precise understanding of the workflow recommended by each company. In most cases, it is recommended that the arch scan and the scan body are done separately. This applies to Medit scanners as well. The scanning is divided into two steps because the scan body is generally smaller than the prosthesis, and a scan of the gingival form is needed to set a subgingival margin for an appropriate emergence profile. However, the process of scanning the scan bodies separately sometimes leads to confusion among clinicians and dental technicians when communicating and interpreting the scan data. There are two ways to use scan bodies in Medit. The standard workflow is scan it separately, while the other method involves scanning in a single file. Which method you choose would depend on the situation. This user performed a good scan body scan, but after post-processing, the data was lost. This could happen when there is confusion with the workflow. As other users replied, it's likely that the scan body scan file was saved separately and the user missed it, or the user might have skipped recording the scan body stage while scanning. So if you choose to scan separately, it is imperative that you follow the exact Medit protocol. This is a video that we highly recommend new Medit scanner users watch. As we can see in the Medit trainer video, the standard protocol involves a two-step scanning process. By using the lock function, you can prevent unnecessary data, such as soft tissue, from being recorded during the scan body scanning process. This tip will help you get a clearer image. To finish this process, we need to verify our data to ensure that it is well aligned. There is one thing you must keep in mind when scanning the scan body separately. It is recommended to scan not only the scan body, but also two adjacent teeth to ensure it superimposes with the arch scan data. At Dr. Zhang's clinic, the scanning staff are advised to begin scanning from the adjacent teeth rather than the scan body itself. Additionally, before finishing the task, They ensure that there are no mismatched areas in the overlapping regions between the scan body and the adjacent teeth. After verifying everything is aligned well, it can be saved, and then the post-processing stage begins. During this stage, overlapping parts will be deleted, leaving only the scan body data. Think of the adjacent teeth as wings to the scan body, and these wings will be lost in post-processing like Icarus. There was a similar question asked by another user who wondered why only scan bodies showed up when the surrounding areas were scanned as well. As seen in the picture on the bottom left, after post-processing, only the scan body data remains, like an island. You may be puzzled as to why, despite clearly scanning the adjacent teeth, there was no trace of that data left. However, this is the normal feature of post-processing, and the fact that very little residual data remains, as in this case, indicates a more accurate scan. Looking again at the photo from today's question, we can observe some areas of adjacent teeth and soft tissue that were not automatically deleted, likely due to noise from light interference. However, if the alignment of the scan body itself is accurate, this noise data will not affect the precision of the prosthesis, so there's no need to worry about it. Medit's response to this question was that you could just have a full scan skipping the scan body scan. I think scanning the scan body simultaneously with the arch scan can sometimes be simpler and more convenient. Then, when should we choose a workflow that scans separately, and when should we opt for scanning the scan body simultaneously? Our team presented this question to Medit, and they broke down the situations where the simultaneous scan process, rather than a separate scan process, is recommended. If your case meets these conditions, you can proceed with a more simplified workflow by skipping the scan body scan stage. The scan body used in the posted question resembles a healing abutment, which would be connected during surgery, and it is not necessary to disconnect the scan body for the arch scan. Then let's look at an actual patient case using the simultaneous scan workflow. Dr. Zhang personally prefers to simplify the workflow and maximize patient comfort by connecting a metal scan body in the form of a healing abutment during surgery. In this case, the number 35 tooth was extracted, and implant placement was performed 2 weeks after the extraction. Along with sufficient bone grafting on the buccal side, he connected a scannable healing abutment. He chooses between 4 mm and 6 mm lengths, and in this case, since the initial fixation of the implant was sufficient, he chose the 6 mm one to make scanning easier. Once this is done during surgery, scanning is all we need to do on the day of suture removal. The alignment was completed using the AI matching function, a strong feature of the Mediti program, and the entire scan was finished in just 5 minutes. Depending on the condition of the implant, we can decide when to deliver the prosthesis, which makes it convenient for both the clinician and the patient. This is truly a revolutionary workflow improvement achieved by introducing digital techniques into the clinic. Now, let's take a closer look at the simultaneous scanning process through the scanning of a dentiform model. To scan in a single step when starting the scan body scan stage, there is a button in the lower left that allows you to copy the arch scan data. By pressing this button, you can import the scan body data recorded in the arch scan and trim the necessary parts for use. Another important tip, as we always emphasize, is for the user to align and verify the scan body data within the scan program. While it may be a bit tedious, it's the best way to consistently get accurate scan results. It's our job to verify the accuracy of the scan data, not the technician's. So rather than relying on your technician, it's important to familiarize yourself with this process. That concludes the answer to question 2.